um, three speakers that she will introduce. So I'm going to turn it over to Yoshiko and just say thank you so much, Yoshiko, for all of your hard work on this and your good ideas. And I'm going to mute the rest of you, if you don't mind. Okay.
All right.
So Yoshiko, you can go ahead.
Okay. Thank you very much for everybody to join this Zoom meeting. So this is the sixth meeting. I'm very glad we could get together for sixth time, even during the COVID difficult times. Okay. This time I would like to introduce three presenters. Okay, the first presenter is Mr. Gustav Strander. He grew up in Sweden and came to Japan as a high school exchange student for a year. Since many Japanese people asked him about Swedish social welfare, he was interested in social welfare in his country. So he started social welfare in the university and returned to Japan to work, utilizing his experiences in Sweden and Japan. Now his work is well recognized in the field of elderly care. The My Hammer Club, here I am visiting My Hammer Club, here he is working. The My Hammer Club nursing home was awarded the first place for Facility of the Year, Aging in Place at the 5th Asian Pacific Elderly Care Innovation Award in 2017. Also, Mr. Strander himself was recognized as a global aging influencer in Singapore at the 10th International Aging Asia Innovation Forum in 2019. Here he is next to me. Please, Mr. Strander.
So good to see everybody. I'm Gustav, and I will speak a little bit about my experience here, actually managing nursing homes here in Urayasu City, just outside Tokyo. I'll just try to put on my PowerPoint slide and let me know if there are any problems with it. Can everyone see what I'm seeing? Is the PowerPoint slide up?
No, not yet. Make sure you hit that share button down there. Share your screen.
I will, just a moment. Here we go, just a moment.
Yes, we're all learning. There it is, coming. Yes, we can see it.
Yeah.
Yes.
Here we go. So this is me, and thank you, Yoshiko, for introducing me. I did start my studies on all kinds of nursing homes in 1997, and since then I've been visiting several hundred nursing homes in many countries, 8 countries, including I think every nursing home on Oahu in Hawaii. So I'd love to go back someday and see you. I will start with this. I will start with the positive news from Japan, because as I've written here, this is actually from an article I wrote in a newspaper here. There was just too much negative news, even in Japan and about Japan also overseas, I thought. And I just thought that although, I mean, so many people have died from this pandemic, but when we look at each individual case, there's always an immense tragedy. Looking at numbers and comparing them, maybe it's not something we should do, but if you do, I feel very fortunate how few people have actually died here from COVID-19. And that is, I of course, coming from Sweden originally, I keep very much track on Sweden and also other European countries, and it's just a very, very different situation in each country. At least for nursing homes, I've seen that I was very happy to see the speed and urgency from both central and local government here in Japan, where already in January, especially in nursing homes, but also hospitals. We implemented these guidelines very, very quickly and with absolute urgency. As perhaps in each and every one of the countries participating today, maybe it's the same, but already in January and February, we already have a very high alert regarding, for example, the norovirus, other viruses that can at this very time in January, February. So we already had a very high alert for that. But then on top of that, we did implement all kinds of new and very strict policies, both in local society, but also, of course, in the nursing homes. And we do feel that that had a great effect. I'm very sad to see in many countries that somehow January, February, March were lost in political struggles. I do think that I'm so much more in more countries. But anyway, I think Japan did very well in this sense. What we did here, I'm not going to go through each point here, but we did what we always do about when we do heighten alerts against viruses, but just more of it, and with greater. So we did also check everything, double check, triple check, just so that everything is being implemented. And we are very, very sad also to say that we did implement visitor restrictions in February already. And we hate doing that. We are proud to have 800 visitors to each nursing home every month. It's something that we value very highly. However, we had to ask almost everyone to do this digitally. We handed out iPads. We tried to be proactive in also teaching, if necessary, how we can still be connected somehow. But the only visitors we had in February and March, especially, were basically people where the elderly were in end of life, and then we just we were just very careful with the family visits. But I believe that many of these policies that we implemented were certainly helpful. And I'm still amazed that I have 206 employees in our 2 nursing homes and also our home care unit, and none of their families have had a single case of COVID. So I think we might be lucky, but I thank my staff all day and their families for their efforts, because it's been very stressful. Of course, I've asked everyone to not have any outside engagements, not go out eating, drinking. We can discuss this perhaps when everyone is finished or later on at the session, what we should and should not do. But I just feel that society as a whole should, I think we should be able to continue as normally as possible, but for nursing home staff, hospital staff, it's very, very difficult to keep any kind of normalcy. And yeah, we can perhaps discuss what everyone thinks and believes about that. I was also, Dr. Omi is a chairman of several, of 57 hospitals here in Japan, and he is perhaps the #1 leader to lead Japan through this difficult time as a doctor. I do know Dr. Omi, and I think he's fantastic, but he has received a lot of just bad mass media attention, and one of his hospitals had a cluster of virus, and they call it a fiasco. I just can't believe that we shouldn't treat those who fight this virus this way, not socially and not in media either. I also, I just took some of these out because I had to. It made me a bit angry because, like, this guy here, we have so many of these TV people asking the specialists who actually fight this every day and night. And you know, Dr. Omi didn't give me the answers I wanted. It was this journal, he said. And why does Dr. Omi have to give you the answers you want? He's supposed to give you the answers he can answer as a fact. We had just so much of this in especially February, March, April, and May. It's getting a bit better now. But yeah. These are the very much analog measures we implemented, and most of these you will recognize and see, and we are fortunate a little bit that we do feel that the architecture of our buildings are very helpful, so that we can actually do everything, for example, centralized. When we do have visitors, even today, it's a very central place where we can control all these things and make sure that everything is done properly. We also took very great care in making sure that people from the outside and people living in the inside have different routes, use different locations, different elevators, different exits and entrances, just to control where people are doing what. And it's a sad thing to do, but until we get a vaccine, this will likely go on. So we did try some digital solutions. I mean, like today, we use a lot of Zoom and also Skype and other softwares to keep in touch with family members and also with ourselves. All our training is done online today. We usually had some kind of internal training or external training once a week here, but now it's all online, and it's been working quite well. We have a special company that we ask for staff counseling and stress management as an outside service, not just internal, to take care of our staff. And finally, solving the staff shortage challenge. Maybe we could mention this later on. Staff shortage is a very common theme in most countries when it comes to nursing homes, I think, but I can discuss this later on perhaps. The Bunne method is not something I can introduce you in 30 seconds, which is all I don't even have 30 seconds. We use a very special kind of music method here in my Hama Club, and on maybe 30, 40 locations in Japan. We actually use instrument. Every nursing home resident, if they want to, will become a musician in our place. And we have very specially designed instruments to do this: guitars, basses, flutes, chimes, where we create kind of a little orchestras, which is the photo here on the right downstairs, down there. So, okay, this one, perhaps my time is up, so we can discuss this later on. Just this final slide, Mr. President, do you see what I see? This is one of my staff said that to me when we discussed activities. What can we do with all these restrictions? And this is what he told me. This is our sort of inner garden for the nursing home. And I said, what do you mean? I see a garden. He said, Mr. President, I see a beer garden. So that's one of our activities we can do, outside beer garden. Because we have that's my 12. I'm sorry if I pushed it a little bit. Thank you.
Okay, thank you very much, Mr. Strander. Okay, so we have to go on the next presenter. Okay. Next person, Susie Stromberg. Susie Stromberg is the president and CEO of the family of companies. That's plus coupon through to its senior living home care, adult daycare, She joined ACAP in 2001, working in various executive positions. She led a team of 550 employees, overseeing all operations and strategic planning. Since the COVID-19 outbreak, Suji has embraced her leadership role the community
Oh, that day was during campaigning day, the campaign.
and for those who serve them. Susie, please, I don't know.
Things have changed. After campaign, things changed.
Quite noisy. Cassie, can you?
Wait. Mute. Mute.
I'm going to mute you, Yoshiko, and then I'll
Yes.
turn you back on again.
Okay.
Okay, can you hear
Okay,
me, Dr.
Susie.
Braun?
Yes, I can hear you, but I can't see your slides yet.
Oh, there, can you see the
There
slides?
they are. Yes.
Oh, they were on the
Perfect.
wrong screen. Okay. Hi, everybody. I guess good afternoon, good evening, wherever you are. I'm very excited.
I'm done.
Much thanks to Yoshiko and to Dr. Braun and to Dr. Hayashida for inviting me. I am part of an organization that is serving about 900 kapuna on a daily basis and has about 550 staff that we have to provide that service. And so I wanted to just give you a quick 10-minute overview of how we are adjusting and reimagining our programs within our family of companies during the pandemic. So I have some slides to share with you. Let me get started. So what I want to focus on is, the expanding of the resident options that we have done over the last 6 months, as well as our increased communication touch points, our infection prevention and control measures, and then just the impact on the organization for long-term goals.
Susie, can you speak up more?
Oh, sorry.
Yeah.
Can you hear me better?
Yes, for everybody, okay?
Okay, thank you. So when we take a look at just our physical activity, what we've had to do is reimagine how we provide wellness classes to our residents. So this is a great example of Balance Brought to You, which is at our 15 Crunchside community. And so rather than going down to the wellness center in our lower level, we do it in the resident hallways. And so it's an opportunity for them to be with a wellness trainer and continue to do their exercises on a daily basis. And we have continued to leverage technology in order to do where we will videotape this and have it through Teams and utilize it and have our residents be able to also watch it in their apartments as well and follow along. We also have it on our channel 900, which is our CCTV channel that we have in our community.
Hi, Susie. Can you speak clearly because we cannot hear well, okay?
Can you hear me better? Is this okay?
It's a little bit fuzzy. I'm wondering if you take the earphones out and just speak directly into the computer, if that would help.
Can you hear me?
Oh yeah, that's much better.
Oh,
yeah,
okay.
much better. Yeah.
I didn't realize that I had this on the computer. Okay, so this is, if we go back to wellness, this is Balance Brought to You. That's in our health and our 15 Craigside community, and this is an opportunity for residents to continue to do wellness classes outside in their hallways rather than going down to our wellness center, which is a little close quarters. And so we also stream this through channel 900, which is an in-house TV channel that residents receive in their apartments, as well as we leverage technology through Microsoft Teams. We've also had, to get a little creative, for those who like golfing in Hawaii, specifically in Honolulu, the golf courses were closed down. So we had a lot of golfers that couldn't go to the golf course. So our wellness staff made mini golf up in our solarium, which is our upper floor, which was with a lot of space, and they did various different courses. At Arcadia, which is another one of our communities, we had the Let's Get Physical, and this was an opportunity we did bowling in the resident lounges where they could participate in bowling, and it was more to not only talk about and help their engagement and their physical activity, but was also socialization and making sure that residents were physically distant, but also having a little fun at the same time. Diversified programs. We diversified the wellness aspect, which is the physical, but we also had to look at diversifying our programs that we offer on a regular basis because we couldn't bring people together in large groups. And so really understanding that the ever-shifting environment for our residents, we had to look at ways to reimagine the program. And so this is one opportunity where we had a small talk story session, And actually, Ashley, who's our programs manager right there, she's holding up actually a picture of things that were going on in Japan. And when she held that up, the resident who's sitting directly across from Mrs. Ishihara, who has her head back to you, this resident started singing a Japanese song. And some of these residents have cognitive decline, and it just really gave an opportunity for them to reminisce and talk story and just
Lenora
have a
Springer joined the meeting.
Another opportunity that we have is craft projects. So it's a take it and make it craft that we have at each of the resident floor lounges. So this was faux stained glass. And so we take it to the residents so that they're not necessarily roaming and gathering in large groups within the community. This is nice. Both of our communities have shuttles. So the shuttle has kind of been used only for medical purposes at this time. And so with the loosening of restrictions in our county, we were able to have holo holo, if you will, kind of, just going and hanging loose and being able to take tours through Waikiki and have the residents be able to get out and enjoy time looking at going to Waikiki. That was also nice. And we did that at both 15 Craigside and Arcadia. The way to our residents' hearts is through their tummies, and so food is a very important part within our community. And the thing is that we don't have communal dining anymore. We have in-room dining. And so with that, a lot of the extras that residents used to get during dining, or that they would be able to go out to Costco, or they would be able to go out to Marakai, they're no longer able to do that. So we brought it to them. And so there you can see in the first picture on the, I guess, the left-hand side, there's a whole line of residents waiting to come in line and pick up the goodies from Costco. And then the next slide is what we call our Manuaki market, which is the quote free market. These are all the items that they can't get at the buffet anymore. And so we give them the opportunity to come down and pick them up once a week. So that was talking about, expanding resident programs, but another huge area that we've had to look at is really increasing staff communication and staff touch points through the pandemic. And these are just some examples of what we've done. Daily wellness screenings. Every employee is screened before they come in, both a wellness screening as well as a temperature check. Weekly emails to staff. We have 550 staff, so it's quite a feat to make sure that we get information sent to them in a very timely manner. We have bi-weekly teleconference calls through MS Teams, frequent pop-ins to make sure that staff are doing okay with their residents and their clients. One nice thing that we developed was our Silver Linings newsletter, which I think is kind of on, it might be on issue 23, and it's a newsletter to just celebrate the great things that are happening during a really crummy time during the pandemic, and it's really given people a lot of hope, I think. Social media posts have been very important to share the good news that within our family of companies, and then just of course continuous recognition and appreciation of staff. We've also increased weekly updates to our residents, in-person floor updates. We actually have a positive case in our building that we found out today, so I spent the afternoon going to all the floors at Arcadia and talking with the residents and informing them of what's going on. And I want to highlight our mask mavens. These are residents who at the beginning of the pandemic back in March, they sewed close to 5,000 masks, reusable masks that have been available for residents, community members, and for staff. Again, leveraging the technology. These are residents in our nursing home level, our skilled nursing intermediate care, and just utilizing FaceTime, utilizing Teams, in order to be able to have them make contact with their loved ones, because they have been under a no visitor policy for going on 6 months, and it's been hard, and I'm sure many have experienced this as well in different countries also. Infection prevention remains at the heart of everything. I won't go into this, I'm probably preaching to the choir here, but the most important thing that we have found with stopping COVID-19 from coming into our buildings and programs is our staff taking seriously the wellness screening form. Making sure that they answer it truthfully, because we see that staff is the one that brings the virus into the building. And then when we take a look at how does this impact our long-term goals, we have 4 things that we, manage our margin, making sure that we have the money and continue to do the good things that we can even after the pandemic.
Sorry, Susie, one more minute.
Okay,
One more
continue
minute.
to engage all of our stakeholders and definitely be proactive in meeting their needs. And then occupancy, marketing, and resident move-ins, and just thinking outside of the box always remain top of mind as we continue to move forward. And then finally, the impact of the social isolation on our residents remains top of mind. So really looking at expanding those programs that we offer become kind of that hallmark of making sure that we make it through the pandemic. So with that, that kind of ends it, Yoshiko. Kind of moved through it, but I hope that provides a perspective on what the family of companies has done throughout the pandemic over the last 6 months.
Okay. Hi, thank you very much, Susie. Okay. By the way, I would like to introduce the third person. Okay. Miss ID Yuran Shen, Service Director, Hong Kong Shanku Welfare Council Limited. ID was the service supervisor of primary school council services and the superintendent and the residence care home for the elderly. She is the superintendent service director of Hong Kong Chuan Kung Hui nursing home now. She believes God's grace is sufficient and life is full of hope. That motivated her in working closely with her residents, clients, and colleagues. She loves and cherishes life. Thus, she always wants to contribute more and dedicate herself to meaningful services. Okay, thank you. Please, Miss Lady, ID. So I'll give you the time, okay?
Yeah, thank you. Can you see the PowerPoint? Yes, okay. I'm grateful for your, sorry? Yeah.
Yes, please do, okay?
Okay, thank you. I'm grateful for your kind invitation to be here today and share some of my thoughts and concerns regarding the kinds of adjustments that residential and long-term care facilities have made during the pandemic in Hong Kong. COVID-19 outbreaks in long-term care facilities can have devastating effects on the health and well-being of residents, as they are vulnerable to serious infection due to their old age and possible underlying medical conditions. Past studies have shown that the proportion of elderly people living in residential care homes in Hong Kong is the highest in developed regions. It is 3 times that of Taiwan and Singapore, and twice of Japan. Besides, the spread number of infections and deaths in nursing homes in Europe and the United States in early stages of the pandemic is truly frightening. There are 40% to 70% deaths from nursing homes. This has become one of the themes of international media and scholars' attention. Besides, Hong Kong was hit by several novel infectious diseases in the last 2 decades. Avian influenza, SARS, and influenza A pandemic. The Hong Kong government has set up a preparedness and response plan to ensure that we are equipped with the core capacity to prevent, detect, categorize, and respond quickly. Residential and long-term care facilities also try their best to respond and cater to specific novel infectious diseases. The global epidemic is becoming more and more severe. The COVID-19 mortality rate in Hong Kong was very low before July. In the first wave of the pandemic, the death rate rose. As of mid-September, among 103 deaths, 30 were from residential care homes for the elderly. Therefore, epidemic prevention work in residential care homes is trying to avoid infection in the facility. Even if there are cases, it can reduce the possibility of outbreaks. As far as Hong Kong Shan Kung Hui Council, where I serve, we operate 9 residential care homes for the elderly, providing around 1,300 places. We also have long-term care service for the persons with disabilities. Their frailty condition can be emergent, and the eldest resident is now 105 years old now. information about the emergency of novel infectious disease is likely to be scarce during the initial stages of the outbreak. Risk assessment under these circumstances requires flexibility and possibly erring on the side of caution. The response measures will be suitably adjusted when better risk assessment can be made in light of more available information to prevent the spread of COVID-19. Several precautionary measures and adjustments have been implemented since January. Firstly, visiting arrangements in all RCHEs have been suspended unless on compassionate ground. Our staff keep communicating with family members and explain to them that a compassionate visit arrangement is only allowed under special circumstances on an individual basis. Visitors should be limited to one at a time, and they need to adopt strict infection control precautions. During the suspend of visit, social workers also explain and comfort the residents promptly, strengthen psychological support and care, and try their best to keep the residents in contact with their families, including using WhatsApp or WeChat. They also send photos and videos of residents' lives to the families at least twice a week. The epidemic has lasted for nearly 9 months. For residents' social and psychological needs, we try to continue to maintain basic social activities, but we need to pay attention to maintaining appropriate social distance. We keep the environment clean with good ventilation. Residents should wear surgical masks where feasible. During meal times, we try to avoid having meals together with others. Firstly, consider staggered meal times to reduce the number of residents gathering in dining room. Otherwise, keep at least 1 meter apart from each other. Sit facing the same direction and install partition between seats with proper cleaning and disinfection after use. Our staff try to design and make patterns with special patterns, such as heart-shaped and fish-shaped, which you can find in the photos. At the same time, social workers assist in delivery of food from the family and arrange for care workers to help the residents to enjoy the snacks, dessert, or soup. Besides, the staff also keep a clean and hygienic kitchen and ensure food safety by adopting proper food handling practices. In order to reduce mass gatherings and minimize cross-infection, the homes avoid cross-floor activities and mass programs, and instead organize small group activities and individual training, and make good use of smart technology and equipment. One of the feasible adjustments is the physiotherapist and occupational therapist moved to the training equipment in the dream room to the residents' dormitories to continue to provide daily rehabilitation training. We would avoid the sharing of equipment and disinfect after use. When training that involves a common object, for example, board games, we can provide social distancing can be managed, and observation of hand hygiene as appropriate. It also broadcasts different types of music, golden songs, radio, news, and epidemic prevention information through the public announcement system. The homes have taken extra measures to facilitate multidisciplinary cooperation and to continue to improve service quality. For the entertainment and fun, we make use of IT and general technology products, such as companion robots, electronic pads, communication device, switch TV games, etc. Besides, tablets, smartphones, and multifunctional robot Tammy provide an effective solution to bridge the service gap under those prevention measures. It not only can provide entertainment for residents, but also can undergo video conference with relatives and telemedicine with the medical officer in the hospital authority. we can receive a prescription and pick it up at a pharmacy near the homes. Most of family members of the residents show understanding and recognition of the staff's valuable contributions towards maintaining services as normal and performing extra duties concerning stepping up the infection control measures. Strengthening infection prevention and control practice is crucial to prevent the spread of COVID-19. Our Welfare Council set up the Epidemic Risk Management Committee to formulate various effective strategies, guidelines, and take precautionary measures to minimize the risks in the RCHEs. Drills were also conducted in January. The drills have been smoothly conducted.
You have 1 minute, okay? Thank you. 1 more minute.
Okay. And the drills have been smoothly conducted and have achieved their purpose in early stage. And we committed to implementing the plan and guidelines from the Center for Health Protection in Hong Kong. With the reference of WHO, it expressed that there was no outbreak in our facilities. Early identification, isolation, and care of COVID-19 cases are essential and important. We have established several prospective surveillance, such as assess each resident at least 3 times daily, especially those new residents at admission. Immediately report residents with symptoms to nurses, isolate all cohort residents who have discharged from hospitals. The Social Welfare Department conduct 3 rounds of virus tests for employees in long-term care facility. We move those residents and staff from affected premises to quarantine camp for 14 days since the last exposure. Yeah. And thank you for your listening.
Okay, thank you very much, Heidi. Okay, then Catherine, do we have many questions?
Yes, we do have many questions.
Then first of all, Mr. Strander is next to me, and he wants to show everybody how is Brunei, okay?
No,
later. Okay,
let's talk. Any feedback, questions?
Okay.
Just let's give it to Catherine.
Okay. So there's a question about isolation and loneliness as a problem for the residents. There's also some questions about mental health, but I think let's start with the isolation and loneliness. Thelma, do you want to say more about that question?
To whom?
This is Thelma's question, so I just wondered if she wanted to explain more about it, or?
Yeah, okay. Can you hear me now?
Yes.
Have I unmuted myself?
Yes.
Yes, okay. Yeah, in nursing home now, because you have restrictions on visitations and communication with the outside world, I've read about problems with loneliness and isolation. And I guess this is inevitable, but how do you strike a balance between safety concerns for residents and also the state of their health, the mental health especially? And what do you do about it? Do you make a special effort to attend to that? Thank you.
So I guess anyone can answer that. Shall we start with Heidi? You just spoke about reducing the isolation and loneliness. Yes.
Yeah, thank you for your questions. It's a question and the problems for our residents. So we need to pay attention to their psychological needs. Social workers take a very important effort to share with them and talk with them. And even when they have some sick or something, they concerned about their family members, we will make use of the phone call and video conference with their family members. And also our staff will let them to have a walk around inside our nursing homes and then chat with them, something like this, and provide different kinds of programs, activities. Yeah.
Okay. Susie, would you like to respond to that as well?
I echo everything that Ivy just said. One tool that we do use to monitor kind of depression is the geriatric depression scale, the rating scale. So, we do monitor our residents that way by seeing what their depression rating is. But it's all about continuing to leverage technology, continuing to make sure that we connect them with their family members, and also programs and getting them don't keep them in their rooms all the time, get them out in small groups, socially distanced with masks if they can. And that's on the nursing home level, getting them to interact. On our assisted living side, it's the same thing, but a little more active in terms of our residents. So yeah, it's a balance, and yeah, hope that answers it.
Okay, great. Gustav, you want to add anything about that?
Just really shortly then that, I mean, we know very well that loneliness and lack of interaction with loved ones or community will definitely, I mean, we have 80% of our residents have some kind of dementia disease, and it's really, really bad for most people with dementia. But it's also very, very bad for healthy elderly. And that is one of the slides I was unable to show today. I think I don't have enough time for it perhaps today, but it's just a great slide of how community interaction and cultural activities actually, if a lack of it will lead to frailty, which will lead to a lack of independence. And that's, I'm amazed that a Tokyo University professor was able to show this by numbers. He did a survey of 50,000 people in one Japanese town, basically all of the independent elderly in that city. And he followed them for a long time, seeing who becomes frail and who becomes care dependent. And he could, I mean, physical activities, we understand that's important, but he was amazed. He said that cultural activities and community activities are that important to prevent frailty. I'm also amazed to see these numbers. If my slide is out there somewhere, please have a look later.
Yeah. Okay, great, thank you. So we have another question about special programs for people with dementia, as they are very vulnerable to COVID. Maybe they cannot understand why they need to isolate. Heidi, you want to say anything about special programs for people with dementia?
For the dementia cases, they may not really know the problem of the COVID-19. So we share with them daily and may let them to walk around in our dormitories and some dream room, and let them to talk with our staff and make use of the IT. For example, the electronic pads and the TAMI. So and to entertain their leisure times. Yeah.
Mm-hmm. Yes, the electronic pets. I've seen that in my father's place. Very popular. Yes. So there is a question specifically for Susie and maybe all of you about staff, background of the staff, and any kind of shortages that you may be experiencing.
So for us, knock on wood, we've been pretty fortunate. We have not had any shortages with staffing. The only shortages that have come out is that employees might be off because they've had exposure or they might have tested positive for COVID-19. However, that's not the case for most in Honolulu and Hawaii in general. From what I understand from the Hawaii State Center on Nursing, is that there are post-acute nursing homes that have a 50% shortage in staff because either they are scared to go to work, they don't want to go to work, or they've been exposed. And so, our organization, I think it's a tribute to our communication, to our education, and to just constantly engaging with our staff that we have not experienced that massive shortage. But we do have plans in place if that happens, in partnering with our trade association. But yeah, we haven't had the shortage problem in terms of training and background. It's just continuing to educate them constantly on you know, the regulations for COVID and what's changing, but then also on helping them to understand how to differently engage with residents during the pandemic.
Okay, great. And how about in Japan? I think, did you say you had no staff shortages?
We do.
We do, and it's absolutely terrifying. However, the one line in my slide there was that what we have experienced these last 6 months is quite a high increased interest in changing from another industry or another service industry into becoming a care worker. And I mean, it's potentially a sad reason for it, namely that people are afraid of losing their jobs.
Right.
But no job losses in this industry, right? So I think a lot of people have started wondering that if it's possible to get even a junior position, and if you have a great internal training program for people with no experience, then this is actually a chance to recruit and to train and to educate staff. So our staff situation this year has been very good. Which we
Ironically, right?
Very, very interesting. So there's another question about, and I'm going to ask Heidi, before and after COVID, comparing the health status, have you seen deterioration? Have you seen residents getting worse?
Yeah, in our nursing home, our residents is already under the faculties, the problem. So without without some programs or without the caring, there's even affect their health and medical conditions. Yes, it's really. So we need to make some conscience and have good observation to their health and conditions, and then if they have the problems, we need to refer to the medical officer as soon as possible, and help them to solve the problem and discuss with their family members. Yeah.
Okay, good. Okay, we have a question from Chandrakala. For each of you, what are the best practices, maybe just one, what best practices do you think your country has adopted for the well-being of the elderly since COVID? What are some of the best practices? Well, it might not have to be from your government, but in your community, what are some of the best practices you think your community has adopted for well-being of the elderly? I don't know, Susie, you want to take a stab at that?
Yeah, I'm not going to go with government because don't get me started. I think when we look at I'm going to go based on Hawaii, our state, specifically Honolulu. I think a couple of things, and this is coming from my perspective, I think implementation of testing has been one thing, and that's something that our organization has fought for, is that you need testing in order to be able to safeguard your residents. But I think another best practice has just been coming together as sister facilities to really share best practices and learn from one another and implement those things, because we're not operating in a bubble. It's sharing of best practices, and we're in this together. And you know, if one nursing home is hurting because they have an outbreak, we're hurting too. So what can we do to help raise them up and help provide any resources that we can? So those are the two: testing and just partnering with one another and supporting each other.
Oh, that's cool. That's cool. How about you, Gustav, about best practices?
I'm actually also very happy to say today that in our little city here, Urayasu, 170,000 people, we have 45 care providers, different, both profit and non-profit organizations. But these 45 companies, we've really come together during this time. And we even have an emergency program to share staff. If one of our nursing homes, we don't have any nursing homes with clusters yet, but And if one of our nursing homes will be struck by a COVID-19 cluster, we will allocate a staff from each. Those staff will work only for that cluster nursing home. And the city, the local city will provide housing for those people for 2 weeks and 2 weeks also in quarantine afterwards. And I think an initiative where 45 companies come together in order to really be able to fight this together is difficult for a central government to implement, but not so difficult for local government. So that's one of our great projects we have here, I think. We have a plan to just, fight it right away if it will strike.
Well, that's really cool. Okay, how about you, Heidi?
In Hong Kong, I think maybe the subvention is enough for our nursing homes and long-term care facilities. For example, sufficient PPE and the money for buying different kind of geotechnology products, and the money for hire more staff for the services, so we can obtain the normal services as usual. Yeah.
Super duper. Okay, so in Malaysia, we initially had some confusion as to whether staff or caregivers were essential and were allowed to travel to and from work. Was that ever a problem for you, for any of you? Susie, not a problem?
No, for us it wasn't. It was pretty clear in our order from our government, our local government, and we actually had little placards made for our staff so that they could carry them with them either on the bus or if they drove. That would not question, and that had their position and what they did for the organization.
Oh, cool. So that was nice. So that came from you. You developed those passes for them. Okay. And how about you, Gustav? Did you have any trouble with getting your care workers deemed to be essential?
I think it's been quite but it's been quite clear here that it's essential. And I mean, and even more so, Japan didn't really shut down with that kind of strictness. Actually, it's more of a not actually that strict. So we haven't had that discussion on that level either as a whole.
Okay. Okay. So there's another question. I'm just moving through the questions here. So are you seeing a shift away from nursing home care, that maybe families are reconsidering and wanting to keep their elders at home? Or are you still having admissions as usual? So Heidi, why don't we start with you?
Yeah, thank you. Yes, really. In Hong Kong, some failed cases, they will not want to stay at our residential nursing home in this moment. So they will move back to their home or community. So their family will take care of them because of some of family members also cohort at home, and they can take care with their elderly people or family members. But in Hong Kong, most of the homes did not have enough area for them for long stage. So some of them still need to move back to our nursing homes in this stage. This is maybe the main problem in Hong Kong for the housing problem and the caring problems. Yeah.
Mm-hmm. So they maybe go home for a while, but have to come back because it's crowded. Yeah. So then when they come back, do they have to quarantine when they come back from the home?
Yeah. When they come back, they need to quarantine for 14 days. Yeah.
Okay. How about you, Susie? Are you having trouble getting admissions?
For our healthcare side, our skilled nursing, no, and we haven't had, the question has come up, but most residents feel safe, their family members feel safe with them living here, based on what they see in the reaction that we've had to the pandemic and what we've done. However, we have seen a decline in our independent residents wanting to move in, and so we've had to adjust to that. whether, people just want to wait it out, they're not too sure. So we've seen about a 2/3 decline in the number of independent living residents that we usually have on an annual basis. So it's to be expected, and we hope that things start to ramp up back next year.
Yes. Yes, I thought people were going to stop buying houses, but now people are buying houses during this time. So yes, I mean, there's a change, there's just dips and peaks in this as well. Okay, Gustav, here's a question for you. What are the immediate challenges in providing long-term care?
I mean, so the challenge will remain the same. I said the staff shortage has really been the most difficult challenge in Japan already for many years now. And I think it will continue, but like I said, I think it might actually be get better because of the pandemic is one thing. But otherwise, this challenge in Japan is the same as in most aging societies with the challenge of dementia, because the amount of the sheer amount of people with this disease now is syndrome is just difficult to grasp. We are heading for 6 million people in Japan in a country with 126.
Yeah. Okay. All right. So there's about 3 minutes left. Yoshiko, I don't know if you want to close or if I can take, oh, I've lost you now. Well, I don't see Yoshiko, but are there any other questions from the audience? I see Tony has joined us. He has lots of experience in residential care. Cullen has lots of experience in residential care. Any questions from either of you? No? Any questions from anybody? Hi, Tribhuti. Okay. Oh, here's a comment from Malaysia. We still have a long way to go in Malaysia, as 60% of our homes are unlicensed. So that then I guess presents a whole bunch of different challenges. Do you want to speak to that? Delren?
Yeah. Good morning to all of you in wherever you all are. I'm Delren. I'm the current president of the Association of Aged Providers in Malaysia. We are having a long outstanding issues because out of these 1,700 estimated homes in Malaysia, we have only 382 that are licensed. Mostly are due to red tapes, government, local authorities, town councils having different laws for different towns, and that it hinders the licensing. And the main problem we face during this COVID-19 is that when you have unlicensed homes out there, we can't reach out to them to assist them when they needed help the most. In fact, they were the ones that needed help the most as compared to the licensed ones. When the authorities are aware where you are, they could have come and help you. So our association had a tough time trying to locate them, trying to assist them. And when the homes were hit with infections, with the COVID-19, that's where the government wash their hands and you have to take care of yourself because you didn't want to get licensed in the first place. So it's not that they didn't want to get licensed, but the red tapes. So it's a chicken and egg issue. So we were facing a lot of this, and we are happy that the COVID is a bit more lesser of a problem now as compared to the lockdown, and we had a change of government. People were confused. The police were confused. Who can be essential workers? Who is classified as essential and who are not considered as essential? So initially, it was only the civil servants who are essential. Private sector, you are not essential, even though we were caregivers. So we had a lot of tough time here initially, but we pulled through. And yeah, we pulled through.
Thank you so much for joining us and sharing that. It's exactly at the top of the hour, so I'm going to see if Yoshiko would like to close our session.
Sorry, we lost you there, but we switched to iPad.
Okay.
Oh, yes, we see you very clearly.
Okay. So thank you very much for these 6 sessions. So we had a very good time, very meaningful, informative. It is shame to stop by this 6th time, but I hope we can see again in the near future. So thank you very much, Catherine.
Yes.
The whole your efforts to organizing everything. Thank you.
And
very
thank
much.
you very much, Yoshiko, for
Thank
having
you,
this
Catherine.
wonderful idea. So, okay, so everybody unmute
you.
and say aloha.
Hello, bye bye.
Aloha.
Hello.
Thank you so much. Thank you so much for
Good
joining.
night.
Okay, everyone.
Bye.
Bye. Thank you.
Thank you very much.
See you.
Thank you.
Hey. How do you do it? Like this? This is Dong-hee.
Yeah, I will
Yay.
take a picture for you.
Okay,
See you soon. See you
okay.
soon, everybody. Bye-bye now.
Okay, thanks everybody.
Bye-bye. Thank you,
Catherine.
Catherine.
Good to see you. Okay. All right. Thank you, Yoshiko. Thank you, Gustav. Thank you, Thelma. Delrin, that was really great. I really enjoyed hearing about Malaysia too. Yeah. And Chandra, great question. Okay, thank you, everybody.